So should you biopsy? That's always a lot of times you see a lesion, you don't know what it is. Should you go to biopsy? What should you do with it? Well, if it's aggressive, you need to biopsy. If it's not aggressive, you pretty much don't. But there's other things that you need to think about that can factor in whether or not you biopsy this or not. If a patient has a known malignancy, even though the lesion looks non-aggressive, you may be more likely to biopsy. But let's say the patient is older or younger, that could also determine whether or not you're going to biopsy. If there's severe pain in a lesion versus that they just saw it incidentally. So the ones that cause pain, you're probably going to biopsy and work up. The ones that are incidental, you may be more likely to leave alone. Comorbidities. Is the lesion, is the patient, does he have heart failure? Does he have diabetes? If he's at risk to not survive or not do well after the biopsy, you should also be aware of that. Risk to adjacent structures. Is the lesion next to the aorta? Is the lesion next to a rib? Is the next lesion next to the joint or to an artery? That could sway you whether or not you're going to biopsy or not. Also, there's certain lesions that the diagnostic yield are quite low. And so you may want to go to a surgical biopsy versus just doing a percutaneous biopsy. And also patient anxiety. Some patients are, if there's any lesion, they want to know exactly what it is. Other people, they're not going to care as much. And even if there's a 20% risk of this is malignant, they may be able to live with that and may not want a biopsy. That can come into play. However, this is whether or not the biopsy actually occur, whether your recommendations should be based on the imaging and clinical factors and not based on a lot of the other extraneous issues.